Hi, good afternoon. Welcome to the Peace Sleep Clinic. My name is Dr. Prince, and I will be doing your intake and assessment today. How are you? Good, good. Okay, well, just to be sure that I'm talking to the right person, can you let me know your full name? Okay, and home address? Okay, date of birth? All right, looks like I have the right person. So, remind me, you were referred by your general practitioner, is that right? Mm-hmm. Okay. And what sort of sleep issues have you been having? I'm just going to make some notes here. Mm-hmm. Okay. When did that start? Okay. Okay. So for your intake, I'm going to ask you a series of questions. Some of these may seem personal. You can let me know if you're not comfortable answering anything. And that's quite all right. Otherwise, we will just make notes. And of course, your file is completely confidential. Okay. So first, can you let me know, are you single, married, divorced, widowed? Okay. And do you typically sleep alone or with a partner? Okay. What would you say is your main sleep complaint? How long has that been going on? Okay. Do you find that you're sleepy during the day as well? Hmm. About how many times a week? Okay. What time of day does that happen? Okay, after lunch. Okay. Do you snore? Do you know? Does your partner report that you snore? Okay. But no, you don't have a breathing aid or apnea. Okay. Any other sleep issues? Okay. So now I want to get a little bit of a sense of your sleep habits, starting with your typical bedtime. Is that weekends and weekdays, or is it different on? Mm-hmm. Okay. And what time do you typically wake up in the morning? Okay. And is that different on weekends? Okay. So then how many hours would you say you get total on average a night? Okay. Yeah, we want to help with that for sure. About how long would you say it takes you to fall asleep? Say from the time you get in bed to turning out the lights, head on the pillow. How long does it take you to go to sleep? Let's go through your whole sleep routine. So take me through your evening from the time you get home from work. Say, do you work at, well, let me go back and ask, do you work a typical sort of 9 to 5, 9 to 6 kind of job? Okay. All right. So you work Monday to Friday. Okay. Come home from the office in the evening. Okay. What time is dinner? And do you typically cook at home, go out, a little bit of both? Okay. How would you say your diet is overall? How would you, in terms of healthfulness? Okay. Okay, so you get home from work. You either order in, go out, maybe cook. You have dinner. What time is that? Okay, got it. And then what happens? Okay. Okay. And then what time do you usually head into bed? In that time when you're watching TV on the couch, are you fully awake then, or do you sometimes fall asleep on the couch? Uh-huh. Okay. So then you head into bed. What's your habit look like there? Do your whole nighttime routine? What happens in the bathroom? So, okay. How long is that? Okay. And then you're in bed at what time? Okay. Then what? Okay. ASMR. Okay. And how long would you say you listen at night or watch at night? Oh, okay. Okay. And then lights out, video off at what time? Okay. Do you sleep headphones? Okay. Okay. And then you said it takes about how long to fall asleep? Yeah, that's long. Okay. And then once you're asleep, do you typically wake up during the night? How many times? And why is that? Do you have to go to the bathroom? Is it? Okay. And how does that relate to, is your partner usually waking up at the same time? Have you noticed? Okay. And then after you wake, how long does it take you to fall back asleep? Yeah. And why is that, do you think? And just busy head, right? Understood. Okay. And then what time are you getting up in the morning, you said? Right, okay. And when you wake up, how do you feel? Yeah, I'm not surprised at that. Okay. When you wake up, are you aware of having been dreaming before you wake? Are you aware of dreaming at night at all? Okay. And what would be your ideal wake up time? Is that the time you would like to get up every day? Okay. And do you wake up naturally or to an alarm? Okay. After you wake, how long until you actually get out of bed? Okay. And what do you do first? Okay. Then what? Okay. And then you're getting ready for the day. Okay. Do you typically nap during the day? On the weekends, okay. How many times? Each day? Okay. All right. Okay. Okay, so we talked a little bit about your habits before going to bed and then in bed a little bit, but I'm going to go through a series of statements, and you tell me true or false, or somewhere in between. Okay, ready? I usually watch TV or read in bed prior to sleep. The ASMR videos, okay? And are you watching the videos or mostly listening? Okay, and when you're listening, what are you looking at? A screen, okay. Okay, we may want to try to change that habit. That's right, we'll work with you on this, but some of this is just about easing into new habits, okay? All right, next statement. I often travel across 2 or more time zones. No, okay. I drink alcohol prior to bedtime. How many glasses would you say you have a week? And that's typically, okay. Has anyone ever suggested, or have you ever thought that alcohol is a problem for you? Okay, it doesn't sound like it, but I just wanted to confirm before we leave that behind. It can often be a big factor in sleep problems. Do you smoke? Okay. Next statement. I eat a snack at bedtime. What time? Do you ever wake up and snack during the night? Okay. Oh, a lot of people do. Yeah. We hear that quite often. I typically wake up from sleep to go to the bathroom. You said that does happen? Okay. I have trouble falling asleep. I often wake up during the night. Mm-hmm. I eat if I wake up during the night. That was a no. Okay. I am unable to return to sleep easily if I wake up during the night. And how long, on average, would you say it takes to go back to sleep? Oh, okay. Yeah, that's long. I have thoughts that start racing through my mind when I try to fall asleep. You said that was true. Yeah. Okay, we can help with some. There are a few techniques to take that on. We may want to talk about incorporating talk therapy into your life to deal with anxiety in general, but there are some physical techniques we can work on: breathing practice, meditation, and we can do a visualization practice as you're trying to fall asleep that I think may help. A lot of people find that it's very helpful. I wake up early in the morning and I am still tired but unable to return to sleep. No, so on the weekend you could go back, yeah. And then on the weekdays there's just not time, okay. I have nightmares as an adult. How often? Do you know what they're about? Okay. I experience a creeping, crawling, or tingling sensation in my legs when I try to fall asleep. And aside from the creeping, crawling, do you find that your legs are restless, or you find that they're moving? Okay, that's good. I sweat a great deal during sleep. Okay. What temperature do you typically keep your house? So we do find that if you can keep it substantially cooler than that at night, it really helps with sleep. Window open can help, or just air conditioning down, or not turning the heat up. Okay, we can look at that. Okay, I cannot sleep on my back. What position do you usually sleep in? When you go to sleep, what position are you in usually? Okay. Okay, now a few statements about breathing I want you to respond to. I have been told that I stop breathing when I sleep. You said no to, yeah, okay. Okay, well, that's in one route we don't have to go down. It's good. I wake up at night choking, smothering, or gasping for air. Okay. I've been told that I snore. Okay, we said that. I have been told that I snore only when sleeping on my back. No. Okay. So side 2. Okay. I have been awakened by my own snoring. Yeah. Well, okay. We can deal with that. Restlessness. Okay, this gets us back to some of the stuff we talked about before, but maybe other physical manifestations of restlessness besides the legs. But the first statement is, I have uncomfortable feelings in my legs and or arms when I lie down at night. So legs, you said no, but what about the arms? Okay. I have to move my legs or walk to relieve the uncomfortable feelings. That's a no, okay. I am a restless sleeper. Are you in general? I have been told that I kick or jerk my legs or arms during sleep. I have a hard time falling asleep because of my leg movements. That's a no, right? I have talked in my sleep as an adult. And do you know whether the speech is understandable, or is it just mumbling? Do you know? Okay. We will keep an eye out for that in your sleep assessment. I have walked in my sleep as an adult. Okay. I grind my teeth. Do you wear a night guard? Okay. Okay, now we're going to look at daytime sleepiness, which we talked a little bit about before. I take daytime naps, you said mostly on the weekend. Do you ever work from home? And on those days, do you find that you take a nap? You still don't, okay. I have a tendency to fall asleep during the day. And is that at your desk while you're working? Or? And you said what time? Okay. I have fallen asleep while driving. Good, good. I have had auto accidents as a result of falling asleep while driving, so that's okay. I fall asleep during conversations. Okay. I fall asleep in sedentary situations. Movies is a big one. Anything where you're sitting still, conferences, conference room, meeting. Okay. Okay. Yeah. Well, this is helpful. I performed poorly in school because of sleepiness. Okay. And when, do you recall when it became an issue that you were aware of having a problem with sleep? Okay. Got it. I have had injuries as the result of sleepiness. I have had sudden muscle weakness in response to emotions such as laughter, anger, or surprise. Well, you would see it. I think you would know if you had it, but it's with a sudden strong emotion. It's a feeling that like you might collapse, is what people report. No, okay. I have had an inability to move while falling asleep or waking up. No sleep paralysis, okay. I have had hallucinations or dreamlike images or sounds when falling asleep or waking up. Right. Well, this is that. People report that a ghost came in and sat on their legs or held them down. Yeah. That is, we think, but aside from the possibility of real ghosts, is a sleep phenomenon that is pretty common. But you're not having that. Okay, great. I drink caffeinated beverages during the day. Okay. What do you drink? Okay. And how many cups or bottles? Wow. Okay. That we're probably going to want to look at. I'll just try to ease it down a little bit. Again, all of this is, there's nothing that we're not going to give you any rules for how to live, obviously. All of this is about a little bit of behavior modification. And a few small changes can make a big difference. Yeah. Okay. Okay. You said you do not smoke, correct? Did I ask that? Yeah. And alcohol, we talked about. Okay. We talked about your sleep history. Okay. Employment status, currently employed? Yeah. Feel secure in your work? Well, you feel like you're not in an imminent danger of losing your job? Okay. What would you say causes you stress in life? Okay. Mm-hmm. Yeah. Right. Okay. Okay. Thank you for telling me that. I'm going to ask a few more questions about your job, and then we'll go to a couple of other questions. Does your job require driving a vehicle? Good. Do you work with dangerous equipment or substances? Shift worker and rotating shifts, is it no? Right, yeah. And you're not a permanent third shift worker. We talked about your hours, okay? Okay, let's do a little bit of basic medical information. What's your height? Okay, weight? I know, I told you it was going to get personal. Okay. What was your weight 1 year ago? What about 2 years? Okay, so no substantial change. Okay. When was the last time you had a substantial change in weight? Okay. What medications do you take? Do you know the dose? Okay, we'll get that. Anything else? Okay, for allergy? Right. Okay. What are you allergic to? Do you know? Any pharmaceutical allergies? Have you ever had a sleep assessment before? Okay. Have you ever had an overnight sleep study? I assume no. Okay. Well, we will do both here. Okay. We covered that you have not had a CPAP, right? No surgical treatment for a sleep disorder. No any medication prescribed for sleep? Uh-huh. When was that? Do you remember, happen to know the dosage? Oh, no, we'll find that out too. Okay. Okay. Now I'm going to go through medical history, and I'm just going to race through a series of conditions. You let me know if you have had them or if anyone in your family and has had them. And by family, I mean parents, siblings, grandparents, children. Okay. High blood pressure. Okay. Heart disease. Diabetes. Who was that? Type, do you know? Type, okay, type 2. And on insulin or just diet? Okay. Stomach or colon problems? Mm-hmm. How old was she? Okay. Lung problems, COPD, asthma. Okay. Reflux, fibromyalgia, stroke or TIA, which is sometimes called a mini stroke. No. Blackouts, seizures, back or joint problems, arthritis. Mm. On which, and your father's too. Okay. Cancer. Right. Any others? When was that? How old? And what was the outcome? That's good. What was the treatment? Okay. Thyroid problems, hepatitis or jaundice, hearing impairment. Oh, okay. Depression or severe anxiety. When was that? And were you prescribed antidepressants? Which one? Do you happen to know the dose of that one? Okay. But not now. Okay. Alcoholism in your family? Okay. Chemical dependency or abuse? Okay. Okay. Any other medical problems that you've had in your lifetime? Was there surgery? When was that? And was it effective? So no problems with that. Okay. Okay. Any other surgeries? Okay. So now I want you to let me know if you've had any of the following symptoms in the past 12 months. Ready? Frequent headaches, fainting or passing out, sudden loss of vision or strength, inability to speak, hearing loss or ringing in ears. How often? How loud would... Okay. Hoarseness for more than 2 to 4 weeks. Nosebleeds. Cough for more than 2 to 4 weeks. When was that? And did it clear up on its own? Mm-hmm. Shortness of breath or wheezing. Swelling in feet or ankles. Chest pain, tightness, or pressure. Irregular, sudden, fast heartbeat. Difficulty swallowing, food sticking, going down the wrong way, none of that. Okay, good. Frequent heartburn or indigestion. Abdominal pain. Okay. Frequent constipation or diarrhea. Okay. Any bleeding, rectal bleeding or black stools? No, good. Difficulty urinating or incontinence? No blood in urine? Okay. Urinating more than 2 times per night? How often in the last year would you say that's happened? Okay. Pain in joints or bones? Unusual bruising or bleeding? Epilepsy, seizures? No? Okay. Change in any wart, mole, or skin growth? And a weight loss of more than 5 to 10 pounds we talked about was a no, right? Okay, we talked about your family medical history. Now we're going to do one last piece. And this is where I want you to give me a series of answers. For each statement I'm going to say to you, you can say never, rarely, sometimes, usually, or always. Okay? When we talk about frequency. Or if it's a statement of opinion, it would be strongly disagree, disagree, not sure, agree, agree strongly. Got it? Never, rarely, sometimes, usually, always. Or strongly disagree, disagree, not sure, agree, agree strongly. Okay. I have trouble falling asleep. I wake up often during the night. At bedtime, thoughts race through my mind. At bedtime, I feel sad and depressed. When falling asleep, I feel paralyzed. When falling asleep, I have restless legs. I wake up suddenly gasping for breath. No. Again, I know some of this is redundant, but you'd be surprised how sometimes answers change during the course of the interview, so we just want to ask a few different ways. But so far, everything seems consistent for you. At night, my heart pounds, beats rapidly, or beats irregularly. I sweat a great deal at night. Okay. My sleep is disturbed by sadness or depression. I have a lot of nightmares, frightening dreams. I feel unable to move after a nap. I have dreamlike images as I wake up in the morning, even though I know I'm not asleep. I have been unable to sleep at all for several days. I feel that I have insomnia. I am very sleepy during the day and I struggle to stay awake. I got bad grades in school because I was sleepy. In the past 6 months, I have fallen asleep while eating, talking to someone, riding a bus or car, reading a book, watching TV or a movie, listening to a lecture. Right. Okay, that's not surprising. I now have trouble doing my job because of sleepiness. I often have to let someone else drive the car because I'm too sleepy. I see dreamlike images either just before or just after a daytime nap. Yet I'm sure when I am awake when they happen. I'm often unable to move when I wake up. Did that again. Sometimes I realize I have driven my car to the wrong place and I can't remember how I did it. I get weak knees when I laugh. That is that phenomenon we talked about. I get sudden muscular weakness when laughing, angry, or in situations of strong emotion. No. I have high blood pressure or once had it. No. My desire or interest in sex is less than it used to be. I'm unhappy about loving relationships in my life. Okay, we'll talk about that as well. I have considered or attempted suicide. Someone in my family has been hospitalized for a psychiatric illness or nervous breakdown. I smoke tobacco within 2 hours before bedtime. That was a no, right? I have problems with my nose blocking up when I'm trying to sleep. Okay. My snoring or my breathing problem is much worse if I sleep on my back. My snoring or breathing problem is much worse if I fall asleep right after drinking alcohol. Okay. Lastly, I'm going to ask you a series of behaviors. And if any of them happen during sleep, let me know. This is while asleep. Yep. Loud snoring, light snoring, twitching of legs or feet, pauses in breath, grinding teeth. I did say yes to that one. Sleep talking, maybe. Sleepwalking, bedwetting. Good. Sitting up in bed while still asleep. Head rocking or banging. Kicking with legs. Getting out of bed while still asleep. Biting tongue. Becoming very rigid and or shaking. Okay. All right. Well, that is helpful. The good news is that I think nothing you reported strikes me as extraordinarily out of the range of what we see all the time. There are a lot of techniques we can use to help. There are medications that can help. There are therapies that can help. And so what we're going to do next is take you to your room, get you checked in. You will spend the night. As you know, we will observe your sleep, see what your sleeping habits look like, and we will do this for 2 nights, and then we'll assess that and your answers here, and then we'll come up with a treatment plan. Okay, does that sound good? Okay, do you have any questions for me? Okay, great. All right. Well, thank you for coming in. We are looking forward to working with you, and we'll get you someone to check you into your room in just a few minutes. Thanks.